Hi, I'm Justin Riley. Today on Wisconsin Doctors, we'll be on location at Upland Hills Health in Dodgeville to learn about the outstanding board-certified level of care that you can receive in the emergency room here at Upland Hills. My guests will include two board-certified emergency physicians. Dr. Joseph Hansen, who went to the University of Wisconsin School of Medicine and had his residency in emergency medicine at the Medical College of Wisconsin in Milwaukee. Dr. Sarah Gerlach, who went to the Medical College of Wisconsin and did her residency in emergency medicine at the Medical College of Wisconsin as well. And we'll also be joined by Michelle Helen, who is the Staff Development Coordinator at Upland Hills Health. She's going to talk to us about some hunter safety tips this fall. It's all coming up right here on Wisconsin Doctors. Stick around. Welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and I'm joined today by several folks who work in the emergency room here. My guests include Dr. Joseph Hansen, Dr. Sarah Gerlach, and Michelle Helen. Welcome, folks.
Thank you.
So good to have you with us today. Yeah. So I want to start off by just kind of having you guys each give an introduction of yourself and just kind of ask you what led you to want to work in the emergency room. Dr. Hansen, let's start out with you. Talk to us a little bit about your education and what made you want to pursue a career in the ER.
Yeah, so I actually had a little bit of a varied path to medicine. After graduating from college, I worked as a carpenter and then on a cement crew. Eventually ended up fighting wildfires out west and started a PhD in forestry and sort of found myself missing human interaction. So I went to medical school in Madison. I did my residency training in Milwaukee in emergency medicine. Then I moved out to this area. I live near Dodgeville, and emergency medicine just seemed like a natural fit for me, given the variety that really you see when you're working in the emergency department.
You've got quite a storied background.
Yeah, it was a little bit of a wander. I never really had a career in mind until I woke up one day and said, gee, I should probably find a permanent job here rather than going from one place to another.
Yeah.
It was really a nice fit. I really enjoy it.
Do you ever feel like you're drawing on some of your experience that you've had outside the medical field when you are like in the emergency room?
I think one of the things it really allows me to do is relate to patients of really varied background. I've done carpentry for a year and worked in sort of academic settings, so that I think lets me relate at least a little bit on some level to a variety of patients, and we definitely see that.
Absolutely. Dr. Gerlach, what about you? Is this something that you decided that you wanted to do from day one, that you wanted to work in the ER?
No, I came to it mostly because I love science. I enjoyed science in high school and college. Ended up in medical school because it made sense for me to combine my science with working with people in some way. I fell into ER just because during my third year of medical school on other rotations, pediatrics, cardiology, surgery, I was always the student who would choose to go down to the emergency room to see that new admission, the new patient. Not many people wanted to go down there. It's a little crazy and chaotic. The students usually got shuffled to the back. But I enjoyed being down there and spent more and more time down there. It just fell into place from there.
You wanted to be where the action was, it sounded like.
I kind of did, I kind of did. I waited tables all through high school and college, and I equate emergency medicine to doing that. You have to keep multiple balls in the air all at once. And
when you're a server, there's a certain degree of triage
there. A little different level of concentration, but it's quick, it's fast-paced, and I enjoy that. It fits well with my personality.
Very cool. Well, now, Michelle, you are not, you don't actually work at the ER, but you've been at Upland Hills for quite a while, and you sort of have, you wear many different hats. Talk to us a little bit about some of those different hats that you wear.
Over the 24 years I've been here, I've worked in, I think, 4 or 5 departments now. Like Drs. Hansen and Gerlach, I also enjoy science, and that was a strong suit for me in high school. And so I knew I wanted to combine science with working with people. After I decided on nursing and started nursing school, I got a job here in the kitchen in nutrition services to make some money, pay some bills. The evening shift worked well for school.
Sure.
And then after graduating in the spring, worked a year on med-surg, working from nights, PMs up to day shifts. Then went back to nights so I could move to OB because I thought that that was then where I really needed to be, was in obstetrics. Worked there for 10 years. And then after doing some co-management of that department with some colleagues and some education of departmental staff, knew that I also enjoyed education, and when this position for the staff development coordinator for the organization opened up, I applied and here I am.
Staff Development Coordinator
Yes.
is your official
Yes.
title. And you've enjoyed that. And how long have you done that now, you said?
About 11 years.
Okay.
About 11 years. I enjoy it. There's variety, similar to the ER and the fast pace or the variety from day to day.
Sure.
I enjoy variety. I might be working with students one day. I might be teaching CPR another day, teaching babysitting class. So a lot of interesting things.
And you worked here, you started working here before you were even out of college.
Yes.
So that's how you can have worked here so long and not look that old. That's great.
Yeah. Well, yeah. The joke too is that we didn't have child labor laws back then.
Oh, sure.
Too.
Yeah.
But
Well, we got to take a short break. It's nice talking with everybody. We will be right back here at Upland Hills Health with more Wisconsin Doctors. Stick around. Hey folks, welcome back to Wisconsin Doctors. We're on location at Upland Hills Health in Dodgeville, and today we're going to find out what exactly it takes to become an ER doctor. So first I want to start out by talking with Dr. Joseph Hansen. I noticed that you and Dr. Gerlach, you list in your biographies that you are board certified. What does that mean, board certified?
Well, the whole process of medical education is a long, obviously arduous
I've heard.
process. Yeah, involves first undergraduate degree and then 4 years of medical school, and then to become a licensed physician, you have to do at least 1 year of post medical school training,
Sure.
A residency.
Right.
And specific to emergency medicine, in order to become a board certified emergency physician, you do a 3 to 4 year residency program that's approved by the board agency. And once you've completed that, do another year of practice and have to take a set of exams. One is oral and one is written in order to become board certified. And then once you're board certified in emergency medicine, it's an ongoing process actually. Yearly you have to do a certain number of hours of continuing education, and then every 10 years you retake a recertification exam. Just helps ensure that you're up to date with all the most current practices and have done enough training in order to really deal with emergencies, which are really quite varied.
Yeah, things are always changing, things are always evolving in the
Yes.
world of medicine, so
Yeah.
it's important that people stay up to date on that.
Absolutely.
Dr. Gerlach, I'm wondering if you could tell me, are all the ER physicians board certified?
Madison Emergency Physicians is an independent group of 41 now. ER residency trained and board certified in emergency medicine physicians. We have 12 of those physicians staffing the Upland Hills Health Emergency Department, Dr. Hansen and myself, and then 10 others. And then the others in the group we staff a total of 6 emergency departments in south central Wisconsin. Some very large, some smaller, some in between. It gives a very good variety of practice locations. And
Sure. So when you say Madison Emergency Physicians, is that kind of like a co-op type of thing where you are sharing physicians between different clinics and hospitals and so forth?
Yeah, we're an independent, one specialty group. We
Okay.
only do emergency medicine.
Got it.
So that is our main focus. It's our primary focus to provide the best emergency medicine we can. So we essentially co-op our physicians. Most docs work at 2 or 3 different sites.
Sure.
I find that typically some people will choose a larger site and a smaller site. It gives you a really nice variety of practice sites and just a really good career base. It's good to kind of move around,
Yeah.
see different things.
And Dr. Hansen, on that note, I wanted to ask, what is it like to work at multiple different sites?
It's honestly one of the things that attracted me to this job, and it's really great to work at a really quite busy place downtown Madison. I work at St. Mary's as well as here, and then come out here, which can be quite busy, but often in different ways, in different patient populations and pathologies. So you can both buttress the experiences at each place, to help keep you current and seeing different things, but have a real varied, shift length and shift experience.
Absolutely. Dr. Gerlach, what's your take on that?
Well, I love it. I mean, there are certain things that I really enjoy seeing. I love trauma, but at our larger site at St. Mary's, it's not the trauma center. UW is the trauma center, and so we don't see any trauma there. So I love to come out here and see those things that I don't get at St. Mary's, and vice versa. I like the pace at St. Mary's. It keeps me fresh. It keeps me, that sort of emergency medicine is the pace.
Sure.
So I think it's good for career longevity as well. You get to, you get tired of one thing, you can move to another, but it's all emergency medicine.
And I think it's really important for our viewers to know how really different of an area emergency medicine is versus, let's say, family medicine. I mean, the pacing obviously has got to be just really, really a lot faster than just having to see patients who come in and the kids who come in for their tummy aches and things like that. This is something very, very different that you have special training for sure.
Right.
So I guess my last question would be, and I'll ask this of you, Dr. Hansen, if somebody wanted to come to Dodgeville for Upland Hills Health for emergency services, what are the benefits of doing that?
Well, I think actually I'm presented with this decision if I have an emergency. I live between here and Madison, so I would choose to drive here without a doubt. I mean, you have the same level of physician experience that you would have at Madison. You have the same technology and much faster to get to the services and less of a wait time.
Less traffic, less wait times, that's all. That's great. We got to take a short break, but we'll be right back with more Wisconsin Doctors right after this. Stick around. And welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and we've been learning about what it takes to become and maintain your level of education if you are an emergency room doctor. And I'm going to start out by asking Michelle Helen, who's the staff education coordinator here. This is kind of where you've gotten involved because there's a lot of ongoing education and training and so forth. Tell me about some of the unique training situations that have taken place this year.
Well, it's really important that all of our staff, including our employees and the physicians through MEP, are always safe and that we can work together as a team. And so a couple of situations that happened in the last year or so was the Ebola epidemic.
Right.
And when we started seeing patients arriving at the United States, and all of the hospitals here needed to be prepared to screen and treat those patients, we did a lot of education and training for our staff, our nurses, and we shared that with the Madison emergency physicians. Now, they might be getting that same information somewhere else and might have been well aware of all of that, but we wanted them to know what our staff were receiving for training so that they could work together as a team and know how we were going to treat patients in our ER.
Did you have to handle any Ebola cases here? I don't think there were any in Wisconsin, were there?
We did not have any.
That's thankfully no. So.
Yeah. But if it's not Ebola, it could be something else in the future.
Sure.
So we're prepared.
Yeah, absolutely. And Dr. Gerlach, I understand that the training goes both ways, and that you guys actually kind of do some lectures and seminars and so forth for the nursing staff here. Talk to us a little bit about some of the health issues that you've shared with the nursing staff here at Upland Hills.
Yeah, I think Michelle brought up a really good point. The most important thing that we can do in the emergency room is work together as a team. When we're able to do that, the patient care is improved immensely. And so if we can provide education, for example, trauma days, we do trauma days a couple of times a year where we review certain trauma care, presentation, stabilization. It can be something as easy as stabilizing a fracture or taking care of someone with a significant head injury. But we provide lectures or education to the nursing staff in the emergency room and the rest of the hospital, because it's all hands on deck when we have something bad going on in the ER. And if we can do that in a way that makes everybody gets everybody on the same page, then the care of that patient is improved immensely.
Sure.
So we've done that with trauma, and we've done education on drugs of abuse, street drugs. We see, unfortunately, quite a bit of that around here. We've provided education on sedation. That's something that we kind of specialize in the emergency room is doing procedural sedation to help patients through a procedure that can be very painful or difficult to do if someone's awake. And the respiratory therapists, the nursing staff, everyone has to be on the same page with the medications and monitoring and care of that patient both before, during, and after the procedure.
Yeah, on all aspects of the continuum of care.
Yeah.
So how often do you do these lectures or seminars, and is it always you, or do you have different people from Madison Emergency Physicians who come and do it? How does that all work?
Yeah, there are providers that come from, mostly the 12 who work out here.
Okay.
And then we're trying to integrate them in with the nursing education that happens at the monthly nursing meetings. We also do really pretty regular EMS education that goes beyond the walls of the hospital, which is really wonderful, helping a lot of the emergency medical services that are volunteer crews in Iowa County. And we're doing essentially every other month an education in service with them about some current topic. We have one coming up here about concussions and sports-related injuries that's really pertinent to the football season.
So you're talking like you do work with like the paramedics and so forth?
Correct, yep.
Very cool.
And then a number of us actually serve as medical directors for those local volunteer EMS services. I'm the medical director for the Mineral Point service, and we're very involved with other Iowa County services to just help bring that expertise out beyond the walls of just the emergency department.
Sure. And real quick before we go, I mean, how do you have like a schedule of topics that you go by throughout the course of the year, or is it something that you say, hey, what do you want to do this month? What's important? What do you think are the latest developments?
Yeah, medicine sort of has a season. Summer is sort of orthopedic injuries. In the winter and fall, you're getting more into some infectious diseases, colds, pneumonias, things like that. So certainly sort of flows just logically in that way. And then there's a core curriculum that we try to keep integrating throughout the whole year.
Absolutely. Well, we got to take a short break, but don't go away because there's still more Wisconsin Doctors coming up right after this. Stick around. And welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and we've been talking about the type of care that you might receive should you happen to need to use emergency services here at Upland Hills in Dodgeville. And we're heading into hunting season pretty soon here, and I just wanted to ask both Dr. Hansen and Dr. Gerlach, do you find that there are any certain illnesses that are happen more at certain times of the year and so forth?
Yeah, so I was actually just checking my tree stands yesterday and thinking how horrified I was that growing up we used almost no safety system in terms of how we get in and out of tree stands. Because having been an emergency physician both here and also having done lots of trauma work in Milwaukee and flown on a helicopter, I've seen some really horrible and devastating falls out of tree stands. And just try to get the point across to people to use their safety systems and know that it's really the transition from getting off the ladder into the tree stand where most of the falls occur. So it's important to be secured as you're going up, because we do see really some devastating falls, both from ladders when people are cleaning their gutters and leaves, and also certainly from hunting-related falls out of tree stands.
And when people think, especially if you're not an avid hunter, when people think hunting accident, they often don't think, falling out of a tree. It's something as simple as that. That's very, very preventable.
Right, and I think people think about gunshot wounds and things like that, which are really rare, but certainly do happen. But along with the falls, certainly fitness is important in terms of people knowing where they're at in terms of their level of fitness before they go out into the woods, and once a year go walk up a really steep hill, which is some stress on the heart that they might not be prepared for.
Yeah.
So it's important to be aware of that, and I know that Michelle's doing some work on that. So.
What about you, Dr. Gerlach? I mean, do you see, is there anything else that you see different, different health-related issues that happen at certain times of the year?
Sure. I mean, I'll talk to non-hunting related injuries since I'm not a hunter. I mean, in the fall where everybody is back in school, so we're starting to share more germs. So we'll start seeing more colds. Enterovirus comes out, and we'll start seeing more GI illnesses. Start seeing mononucleosis in the fall. Strep throat, all those types of illnesses where when the kids are back in school and sharing germs a little bit more, it starts to show up.
In those close quarters. Those classrooms are turning into giant petri dishes.
Cover your cough. I mean, and I also think in terms of talking about falls and ladders, People are starting to do fall cleanup. They're trimming dead branches. They're cleaning up leaves. They're kind of getting things ready for the winter, and that always brings in cuts, scrapes, broken bones, falls, that kind of thing. We had a great trauma surgeon, Joe and I, in our training, who would always say there's no such thing as an accident. If you think it through before you do it, you'll probably be safe.
Yeah.
So even just going up a few steps on a ladder can be a pretty devastating injury if you fall.
Yeah, that's unfortunate. Now, and I'm curious to know, in your experience here, working here at Dodgeville, is there ever any time where you feel like, okay, we've done all we can here, we need to send them somewhere else? Is that a thing that you guys are practicing here?
And that's a big part of what emergency medicine is about, is knowing your facility. And this is really a wonderful facility in terms of its ability to care for patients really with a variety of complaints, and even minor trauma in particular we can manage here, and all things we can manage and stabilize in the emergency department. But one thing that's important for us to know is when is that line where a patient is so sick that they may need a level 1 trauma center, and that involves a transfer to Madison. So I think it's really important for patients to understand that if they have an emergency, they should come see us, let us evaluate them. You get the same level of care you would in the hospitals in Madison, and then if there's something that they need beyond what's available here, we can get you transferred in the fastest and safest way that's possible.
And a big part of what you do is just knowing when it's time to do that, and that's what's really important.
Yeah, it's really managing the first few hours of an emergency, and then understanding where they need to go next.
Well, we do actually have an avid hunter with us today. Michelle, I understand that you're an avid hunter. Tell me just about some of your expeditions.
Well, I've done bear, deer, and turkey hunting here in Wisconsin, and hunted the Dakotas and Kansas and Oklahoma. But I think the most memorable ones would be the caribou hunt in northern Quebec, where we eventually flew in on a float plane. And then also the alligator hunt in Okeechobee, Florida.
Alligator hunt. You hunted alligators.
I hunted alligators at nighttime from the bow of a boat with a bow and arrow.
Wow. Were you ever scared?
We were scared. We had the conversation, if you fall out of the boat, which way are you going to go? Because it's
down.
Alligators. there's no land, so you just didn't want to fall out of the boat.
Right, yeah. So, you're also an RN, an experienced hunter. That's such a unique combination and skill set. Talk to us a little bit about how else you're involved here in Upland Hills Health.
Well, in addition to the day-to-day staff education and training and orientation that I coordinate, I teach CPR and first aid. Okay. I've been working with the marketing department, and we've built a webpage solely dedicated to resources for hunters and outdoorsmen this fall. It's all just a list of resources, articles, how to be safe, prevent illness, start exercising safely, and things like that.
And what is that website? Where do we find
that? That's
at
uplandhillshealth.org/healthy hunting.
Very cool. Okay, we'll have to check that out. We have to go in just a little bit here, but can you give viewers one tip on how to keep themselves safe during the hunting season?
I think to kind of tag on to what Dr. Hansen said, I think it would be to use the appropriate safety gear. So if you're hunting from a tree or a height, use a safety harness, preferably a full body harness. And if you're gun hunting, wear your blaze orange.
Awesome. Thanks, Michelle. And I want to thank all of my guests today, Dr. Joseph Hansen, Dr. Sarah Gerlach, and Michelle Helen, all here at Upland Hills Health. We've been talking about emergency services that you can get here at Upland Hills Health in Dodgeville. That's all the time we have for Wisconsin Doctors. From all of us here at CW57, we invite you to live longer, live better. We'll see you next time.